Karibu and welcome to lesson 2.2 of your MTTI caregiver course, Cleaning and Hygiene Standards. Let us begin. Cleaning physically removes dirt and some germs using soap or detergent and water. Disinfecting uses a chemical product specifically to kill germs on an already clean surface. A surface can look clean but not properly disinfected. The two steps serve different purposes and often both matter. Key point: a visibly clean surface is not automatically a hygienically safe one. Cleaning and disinfecting are two different steps with two different purposes. Door handles, light switches, taps, and remote controls are touched constantly and deserve more frequent attention than, say, a rarely touched shelf. Hygiene efforts should be proportional to how much a surface is actually touched. Different cleaning products should never be mixed carelessly. Bleach and ammonia-based products together can produce dangerous fumes, and products should be stored safely away from a confused client who might mistake them for something else. Simply making a room look tidy is different from it actually being clean and hygienic. A properly hygienic approach follows a genuine process, not just a visual impression. That is lesson 2.2, Cleaning and Hygiene Standards. Next up, lesson 2.3, Household Safety and Hazard Prevention. See you there. Karibu tena.